Thank you, everybody, for joining us today. I'm going to give just one more minute for folks to start coming in and one of our panelists to join. Oh, see, we have here now. Awesome. Thank you, everybody, for joining us today. I see we have a lot of folks joining in today, so this will be a very exciting topic that we're covering today. Thank you all for joining us. For those of you that are joining us for the first time, I'm just going to give a very brief introduction to this community of practice and what we hope to accomplish together. For those of you that I haven't met yet, my name is Carlos Diaz Barriga. I'm director at Hadaway Communications, and along with my colleagues at Hadaway, we serve as the Secretariat for STAT Communications Community. This community grew out of the work of the State and Territory Alliance for Testing, a group of states and territories convened by the Rockefeller Foundation who share insights, best practices, successful strategies, and lessons learned on aspects of the COVID response. The goal for expanding this community and the motivation for these biweekly meetings, as it has been now for over a year, is to bring that same spirit of collaboration that has made STAT such a success to the broader community working on COVID communications. A second motivation is to bring that same rigor and science that informs other aspects of the response to strategic communications. That's why we're so excited about today's conversation, which was creatively titled, if you send that email, Masks and Tests and Shots, oh my. So at one point in January, we had over 1 million kids that were diagnosed with COVID-19, 4 times the previous highest week ever in the surge of the fall 2021. Within a few weeks, if regulators determine that the vaccines are safe to proceed, babies as young as 6 months old could be eligible to receive a COVID-19 vaccine. However, we've seen some recent polling. There was one by the Kaiser Family Foundation that found only about 1/3 of parents say they'll vaccinate their babies and young children right away. With kids over 12 eligible for booster shots, kids over 5 eligible for vaccines, and under 5 vaccines on the horizons, it is vital for parents and those who work with children to understand how to communicate with children about the nuances and complexities of COVID-19, not only vaccines, but the continuous testing and masking. So today we'll be exploring that. We will learn how to have empathetic conversations with parents and caregivers who are still maybe waiting and see about vaccination for their children, even if they are vaccinated themselves, but also help parents make an informed decision based on evidence and communicate directly with children about getting tested and vaccinated with helpful tools and tips and hearing from experiences from experts who have been exploring this. So today we're excited to be joined by Dr. Yvonne Maldonado, Professor of Pediatrics, Infectious Diseases, and of Epidemiology and Population Health at Stanford University Medicine. We're also joined by Dr. Allison Bartlett, Associate Professor of Pediatrics and Associate Medical Director, Infection Control Program, Pediatric at University of Chicago. And later in the webinar, we'll also be joined by Dr. Rupali Limai, who is an Associate Scientist, Director of Behavioral and Implementation Science at Johns Hopkins Bloomberg School of Public Health. So as we go, I really encourage you to leave your thoughts, experiences, and questions in the Q&A box or in the chat box, whichever you prefer. When sharing in the chat, please share with panelists and attendees so that we can all learn from each other. And we will be gathering the questions as we go. So to kick us off with our conversation, I'm wondering for both of our guests, if you could briefly describe the focus of your work in pediatrics. Dr. Bartlett, I'll go to you first.
Sure, thank you so much for having me here today. My name is Dr. Allison Bartlett. I'm a pediatric infectious diseases physician working here at the University of Chicago. And in addition to my work caring for individual patients and their families in the hospital with infections, I oversee our infection prevention activities here as a hospital epidemiologist. So that means I work with a wonderful team to make sure that our patients, families, staff, and visitors all stay as safe as possible when they're here with us.
Thank you. And Dr. Maldonado?
Yeah, sure. I have a number of roles here because I've been at Stanford for quite some time now. I'm the chief of the Division of Infectious Diseases in the Department of Pediatrics. So I have a faculty of just about 30 faculty members and about 100 staff members. So really exciting to work with my colleagues here. I'm also the co-director of Infection Prevention Control at Children's Hospital as well. And then I spend the other half of my time, doing research in understanding viral the viral vaccines, especially in developing settings and global settings in sub-Saharan Africa and Latin America, but also understanding mechanisms of viral transmission. And then the other half of my time, I work as a senior associate dean for faculty development and diversity, as you said, really trying to help support our young trainees and junior faculty as they develop their careers, and to also help foster a culture of diversity, equity, inclusion, not only for our faculty, but for our staff and trainees in our School of Medicine.
Awesome. Thank you both. And thank you both for being here. Again, maybe to kick us off with the conversation, I'm wondering, Dr. Maldonado, what would you say is the most important thing that public health communicators need to remember when talking specifically to parents and caregivers about children?
Well, I'll let Dr. Bartlett also answer this question, because I think as pediatricians, we have a really interesting, of course, every specialty thinks they're best, but as pediatricians, I can't think of another specialty where we have to deal with the whole family in order to care for our patient. And many times our patients can't really talk to us. So we have to develop a lot of very focused and straightforward ways of communicating with our families so that they understand the messaging. The other thing I think we need to deal with a family and child relationship is the anxiety and the concerns that parents have about their children. And so for public health officials, I think making the messaging as straightforward as possible and as reassuring as possible, obviously saying the truth, but giving people something to be hopeful about, and showing them why a particular policy is going to be helpful for people's children in as simple a messaging as possible. And then to always provide people with resources so that they can go back and find out more information, because we know that parents have lots and lots and lots of questions. So just giving them the ability to find places to get those questions answered. But I know, Dr. Bartlett, what you think.
I agree completely. Absolutely correct that there's so many places people are getting information out there. And so, really providing vetted, trusted information as a supplement to the personal communications and relationships that we have with our patients and our families is really important.
Mm-hmm. I'm wondering, for you both, any resources from the topic thread that you consistently have pointed patients to or families?
Yeah, we talked about this before, but I want to make sure everybody hears it. Is, at least for me, the one area that I think is the most resourceful and useful for families and public health officials as well is the American Academy of Pediatrics website. It's aap.org. It has not only a whole section on COVID resources, but all kinds of other sections on school readiness, and it has them for every level, for health professionals, for non-health professionals, for parents, for kids. It's just a wealth of information, and we keep it up to date. So that's one reference that I would tell everybody you should have it bookmarked and ready to go. It's a great resource.
It was just mentioned to be conscious of the anxiety and concern that parents have around their children. Here's Dr. Bartlett, for you, how do you explain to parents and caregivers the rewards of getting kids and children vaccinated?
So that's a really good question. And I struggle a little bit with the rewards. I think it's benefits or upsides. Rewards makes it sound like you get a little prize. Your reward is not getting sick. But I try to explain to the parents that there are two aspects to this pandemic. And this is where science communication gets tricky, because you want to provide all the information that's there, but this is not a 5-second sound biteable issue. So there is a pandemic of an individual person or child getting an infection. And in that context, right, vaccination provides protection against that child becoming hospitalized or even dying from COVID. And we're learning also protects against MIS-C, or the multi-system inflammatory syndrome in children. And then there's a population health level pandemic where we all potentially contribute to the spread and infection in other people, in our family, in our schools, in our communities. And so vaccination, by decreasing my individual risk of becoming infected, also benefits my community. And so I think it's really both of those pieces that are important to speak with the family about when you're discussing the sort of upsides of vaccination. You're helping protect your child and other people who cannot optimize their protection.
Certainly, and that's something we've seen in our own research on communicating about COVID-19. That message of protecting yourself and your loved ones has consistently been effective. I'm sorry, Dr. Maldonado, anything you would add to that on explaining to parents and caregivers the rewards of getting kids vaccinated?
Yeah, I totally agree. I think I've noticed about 15 years ago or so, probably when we started having more access to the internet, families, a lot of my colleagues were saying, I'm spending so much time talking about answering questions. And I think one of the things we see is there's just so many streams of information that people get. It's confusing. It's confusing to us sometimes, trying to tease things out, and the latest thing pops up and you don't know, well, wait a second, is this okay? Was this different from what I heard 10 minutes ago? And so I think just being able to have that conversation with families, and it does take a lot of time, or maybe not a lot, but more than we're used to, I think. But in the end, it does build that trust. Pediatricians are still the most trusted healthcare providers, and most people trust their healthcare providers, and most of those pediatricians are the most people have the most trust in. They're not the most trustworthy, but I think they're all trustworthy. But most people have trust in their pediatricians. So I think part of it is just a lot of listening and answering questions.
Certainly. And Dr. Maldonado, I'm wondering if you can tell us about the experience of leading the pediatric clinical trials of the Pfizer vaccine. Maybe what were your main takeaways from those trials for communicating with parents and caregivers about the vaccine?
Yeah, so fortunately, I live in California, which is one of these places that has really immediately took up the lockdown, the mask mandates, the vaccines. We've obviously eased up on a lot of things, and actually as of next week, all of the area around where I live, which is the San Francisco area, 8 of the 9 counties are going to lift the mask mandate. We're going to lose the state vaccine mandate pretty soon, our mask mandate. And so, but we've had a very strong approach to all of that. So when the pandemic first started, I'm an infectious epidemiologist, so I was involved with a number of early epidemiologic studies looking at transmission and what factors might we understand about the disease. And we started to enroll adults in trials because that's really what we were able to do with antiviral studies. But we thought it was important to get involved with the vaccine trials, especially in kids. Because first of all, pediatricians are all about prevention, and vaccines are just a really important way to prevent diseases. And we know that the systems in place at the federal and state levels are really guaranteed to find the best and safest vaccines that we can use. So even though I had never really been involved with a industry-sponsored trial, most of my research is my own personal fund research or from other federal funds. We thought it was important to get involved with the pediatric trials because we wanted to see how the trials would work, understand how the protocols worked, how transparent the companies would be with their data. And also because honestly, we thought that the local families would be interested and excited to be part of it. And I have to tell you, the response was overwhelming. When we started the trials last year, we didn't advertise. I think people by word of mouth found out we had over 3,000 people sign up for the trials, and we were only allowed to enroll a few hundred. And those families are still ready to enroll their kids in trials if they become available. But it does take a lot of time and effort, which is fine. I mean, you have to make sure the vaccine is delivered appropriately. The visits are very carefully done. I have a very well-staffed clinical research enterprise. I have another physician working with me and a senior nurse practitioner and several clinical coordinators. The families are very engaged. They are really excited to be part of this. I think a lot of that is because they trust vaccines, they trust pediatricians, and the study was done in a very careful way, at least the Pfizer trial, and I'm sure the Moderna was very similar. So I think a lot of it was building community engagement around approaches to COVID, because we use this as a platform to help families become ambassadors within their own communities as well about prevention of COVID, not just from vaccines, but other measures as well. So overall, it was a lot of work. We're still doing the trials now. But it's been a very rewarding process. But one of the things that we've heard from other fields about research is people don't, do their research and they walk away. When you do a project like this, you really need to keep the families involved and give them results as they come up. And that's something that is hard for academic people to always do, is to come back to communities and give them results. And we've been really, keeping everybody engaged from day to day on anything that's going on. And they give us a lot of positive feedback as well. So it does take a lot of time, but we've developed some really good relationships. And hopefully these families they know that they're contributing to potential for vaccinating kids all around the world, and in this country, but also all around the world.
Absolutely, yeah. And they're ambassadors themselves to get others into being vaccinated. Dr. Bartlett, I'm wondering, a couple of weeks ago, you shared with the Chicago Tribune in an interview some thoughts on how to talk to parents and kids when one of their kids is sick with COVID-19, which could be a difficult experience. It's obviously a difficult experience for families. Could you share more about your approach to that and what questions communicators should ask about the situation before launching into factual lectures? What do you always keep in mind?
Oh, absolutely. I think it really is important to get a sense of where the family is emotionally in terms of the level of fear, guilt, anxiety, all of these emotions that come up, and to understand the specific concerns that families may have. I think that it's really important to talk through the fact that there's both worry about the health of this child and then also worry about what this means for the family unit. And those are both important parts to be addressed. With the child themselves, I think it's important to reassure parents that fortunately, most children do not get extremely sick with COVID-19, and review some of the warning signs. And it's important to reassure the child as well that they are going to be well cared for. I think there's a lot of familial stress that can happen as well. Both the disruption of the family, parents not able to go to work because of exposures, siblings and not being able to go to schools, which have different impacts on different families. Parents of teenagers may be able to have their self-sufficient child, sort of stay in a room, wear a mask, and not have a lot of impact on what's going on with the rest of the family. It's important to talk through what that might look like. For toddlers or young children, you can't leave them in a room and just throw food at them a couple times a day. So think about what this looks like for the family. Is one of the caregivers at home more at risk for severe disease or needs to continue to work in a healthcare setting? What does the division of labor look like for your family? How can we use masks? And if you don't live in Chicago in January, outdoors, right, to decrease the risk. There's never a risk-free situation, but there are reasonable steps that can be taken to protect the family unit and decrease that risk while also providing the support and reassurance for the child and the family at issue.
Yeah, I think that's a really great point. I think especially the first thing you mentioned of focusing on the emotions, which I think is a huge part of this. And speaking of that, I'm curious for you, Dr. Maldonado, what would you say kids need the most from adults at this time? What do they need to hear?
Well, children are pretty smart, and all of us who have kids know they pick up on everything around us. They watch us for our reactions to things. And this do what I say, not what I do does not work. They see what we do. I mean, I have 3 grown kids, and it's really funny to hear them talk about what they picked up on when they were growing up. And yeah, they're very observant. They learn from a lot of nonverbal communication as well. So it's very clear to them that something unusual is going on in their world. So I find that the kids who tend to be a little more settled are the ones whose families have really had time to really sit down and discuss, everything about the pandemic. Again, there's a lot of resources in the website that I just sent to you, how to talk to your kids about the pandemic in very simple ways. But being real, being honest with them, but also giving them hope and giving them solutions is really important, and helping them think about ways to express their anxiety and their fears. So children, and every child is different. I know with my 3 kids, I had different ways of dealing with each one. Like my oldest daughter, no question, she would just tell me everything that was right on top of her head, and I knew exactly what she thought. My son was very different. He would keep things to himself, and I had to really draw him out when I thought he was calm and relaxed. Certain times of the day when I knew everything else was off the table, we would just chat, and then things would come about. So every child is different, but you have to make sure you're addressing their own concerns and anxieties, because they may not all come. Some kids are more verbal about it and will come up and say, I feel this, I feel that, but not every child is like that. And so I think our educators on the line are probably experts at this too, and knowing how to address this, and parents can learn how to deal with this if they haven't already. And having and trying different things works too. I think sometimes you might try one approach, you may not think it's working. Sometimes it takes the kids a little bit of time to warm up to a particular issue. Sometimes something may be so frightening to them, they don't want to talk about it at all, and it might take them a little while. So using some nonverbal approaches as well can be helpful, role playing, or playing in games while they're engaging in activities with you. Some things may come up, and it really, I have to tell you, there's no handbook for how to be a parent, but I think just learning what your child's responses are like, and the other nonverbal things you might pick up from them if you're worried about their own mental health or their own anxieties about maybe the pandemic will be, are they acting the same way that they were before? And clearly, I can guarantee you that nobody's acting the same way they were before. But if you feel like they're still engaged, if they're not engaged, if they're not eating well, sleeping well, if they seem to have lost interest in things that were fun for them before, I mean, those are signs that something is worrisome to them. And not to be alarmed by that. That's normal. Children are very resilient, but they need you as a role model and a leader and or a mother or father or other caregiver to just make sure that you track that and find some ways to deal with it. And if you can't deal with it directly, then find others. Your pediatric provider can help, or maybe they can refer you to other resources as well. I do think that the mental health impacts of the pandemic have been substantial. So children are going to need a lot of support there. Coming back to school has been very stressful for a lot of kids. And that'll take a little time to get adjusted to. So I think the tricky part is knowing when are they going to settle in, and when might they need additional help. And I think, again, talking to your provider to see if they have resources can give you, and also to school leadership as well, and public health leadership can help with those questions.
Yeah, absolutely. That's all very helpful to hear. And I encourage also participants in the chat to share their own experiences and advice. The just so Larry, he'll share some advice for other folks. Curious, Dr. Bartlett, in your view, how can pediatricians and public health officials help get parents on board to vaccinate their children? What do you recommend as far as that?
So, one thing that pediatricians always have done well, right, is talk about vaccinations. But I think to Dr. Maldonado's point, the amount of discussion that has been sort of required to help people feel comfortable has been extraordinary. Parents want to keep their kids safe. They want to do right by their children. One thing I talk about is if you decide not to vaccinate your child, you've made a choice, right? It's not, you either choose to vaccinate or choose not to. There have been a lot of concerns about the safety of this new vaccine. And I think that argument gets weaker and weaker and weaker, with every passing month. We've had billions with a B of doses, right, administered.
Mm-hmm.
These vaccines are incredibly safe and effective. I'm really pleased that most children do not get very sick and end up in the hospital, but some do. And every pediatrician you talk to is going to say one child who dies from a vaccine preventable disease is one too many. And there's been risks of myocarditis associated with vaccination in predominantly adolescent young adults. That's an important thing to talk about with that population. But we have nothing but reassuring data coming out about the 5 to 12-year-old age range in terms of the risk of myocarditis being so low, and increasing information about how severe COVID can be, even if you don't end up in the hospital in terms of long haul COVID, and not to mention disruptions of school. I think that it's the same discussion that I have with an individual decision to vaccinate. There are benefits to the child, there are benefits to the family unit and to the community. No kid likes getting a shot. No grown-up likes getting a shot, right? But kids are so perceptive, and they give me hope for the future. They understand doing something that will help somebody else in a way that I think their parents don't always internalize.
Yeah, certainly hear that.
Can I just share a little anecdote?
Please.
And this was right after the 5 to 11-year-old vaccine was approved in November. I was visiting my family in Southern California, and my older daughter was going in for her booster. So we went into the clinic, and there was a dad with his 7-year-old daughter, and she was the cutest thing. She was just bouncing around. Couldn't keep her. He couldn't keep her under control. She was just everywhere, bouncing around. And I asked her, "Oh, are you here for your vaccine?" And she said, "Yes. And after this, I'm going to go see a movie." And she was so excited. And that's the kind of messaging that parents can really make. So yeah, she didn't even notice the vaccine, honestly. And it was hard to even keep her sitting for the 15 minutes afterwards. She had every limb in 3 dimensions. It was so funny to watch her. And but she knew that there was a reason for it. And as Dr. Bartlett said, they're just it's so wonderful to see these young people who really understand the world in ways that I think we make too complicated for them sometimes.
I'm curious with those complications, like you said, adults have a lot of more concerns in their heads. I'm wondering for both of you, what are some of those biggest concerns that you're hearing that are from parents or maybe kids directly, and how do you answer or reassure them? I don't know who would like to go first, maybe Dr. Bartlett.
Sure, I think that the parents feel extra concerned even for their children beyond what they feel for themselves. And it really is sometimes a difficult decision to accept that there is a component of unknown out there. And I think that working through the fact that there's lots of unknowns out there. And I used to not speak a whole lot about my personal family when I was talking with sort of my patients, but I have 3 school-age children, and I was wondering, are my 12-year-old, are my twins going to turn 12? and get a shot then, or is the 5 to 11-year-old vaccine going to be, available first? And, sort of demonstrating that I'm not just out there getting myself vaccinated, getting myself boosted, right? Personally, I feel strongly enough that my children have been, vaccinated as well. I think provides a layer of reassurance.
Yeah, I think somebody brought up in the chat about distrust in communities of color. And I think that's another layer on top of the things that Dr. Bartlett brought up. I mean, we all, especially as pediatricians, sometimes we also think, well, wait, there is that 0.001% chance. And my kids, you say, oh, mom, you're such a worst case scenario person. So try not to think about, think about things, and it's all about risk perception. It really is. We know the vaccines are incredibly safe, but nothing is 100% guaranteed. And so we need to be sure that people understand that, and that even the risks that we see are extremely low severity risks. But there are other things, especially in communities of color or low socioeconomic communities, where there's not a sense of trust or engagement with public health, with government, with large institutions. And I think that's where providers and community leaders that people can identify with really come in really helpful. So I know here at Stanford, we have engaged. This is one of the only silver linings of this pandemic, is we've been able to engage more with our local community leaders, with community town halls, school districts, and religious settings, and a lot of different venues where we've been able to partner with people in our communities that really we hadn't engaged with before. And I think we've built some really nice relationships now where we can work together to support those groups. For example, recently the hospital bought a lot of rapid tests because we needed them because of Omicron. We couldn't wait for the PCR, so we started buying rapid tests, and we wound up donating hundreds of thousands of them to our community centers, where they really were having a hard time getting a hold of them, or maybe didn't have funds, and just building some of those layers of trust. But on top of that, they give us a lot more information than we get back from them, because they can tell us what's the community thinking, what is it that would help the community understand a little bit better about what's going on. And we forget that not everybody is starting from the same point of view in terms of what information they've received or who they're getting it from. A lot of people are getting their information from social media that is really misinformation. And so engaging with community leaders, I think, cannot be overstated.
Absolutely. Thank you. And speaking of engaging, we have our third panelist also here, Dr. Limai, who has a very exciting tool that she's going to walk us through on how to engage parents and other caregivers to become vaccine ambassadors. Welcome, Dr. Limai. Thank you for joining us today.
Thank you so much. It's great to be on. Hopefully you guys can hear me okay. And again, I apologize. I was on bus duty, so I'm a little bit late today. So my name is Rupali Limay. I am a faculty member in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health. And I also serve as the Deputy Director for our International Vaccine Access Center. So I'm a behavioral and social scientist by training. I've been studying vaccine hesitancy and health communication for about 10 years. So when this pandemic started, our work really became very relevant and very pertinent very, very, very quickly. And one of the things that we really wanted to focus on is how do we reduce hesitancy and increase vaccine acceptance? We had a feeling with adults that we knew that this was going to be a little bit of a challenge. I think many of you likely know, but it took us 3 months to move from 58% to 61% of eligible adults over the age of 18 to have the full primary series of the vaccine, right? You then look at the lower populations, the lower age populations, we're not doing great with 12 to 18-year-olds, and we're not doing great with the 5 to 12-year-olds either. We all know that an EUA is likely imminent for children, that are 6 months and up. And so it's going to be really interesting to see how can we really communicate well with regards to this vaccine. One thing that I will comment on is that the reasons why people are hesitant have changed. So I've been studying hesitancy for about 10 years. Before the pandemic, the reasons why people were worried really had to focus on vaccine ingredients. They had to do with risk perception. A lot of parents had never heard of the diseases that vaccines prevent. They also had to do with issues related to the vaccine schedule, i.e., why does my child need so many different vaccines at so many different months? And the last one was this myth and misconception related to that there was a link between vaccines and severe adverse outcomes, i.e. autism. This has been soundly refuted in thousands of studies and millions of people, but that myth still persists and still remains. Since COVID has started, the drivers as to why people don't want the vaccine have shifted slightly. We still see those drivers, but the biggest issue that we're starting to see now is really distrust in government. And as a result, that sort of extends to distrust in the healthcare system. That goes hand in hand, and I've been working very closely with communities of color for the last 2 years or so. And a lot of it has to do with this idea of not only medical and historical trauma related to medical experimentation, but current racism and discrimination that people of color face when they interact with the healthcare system. The other piece that we have been studying quite extensively is misinformation that has primarily been fueled by social media. This has been a huge challenge for us, and simply because many of us were locked down and in our homes, I think more people have consumed more social media and more news from social media than they ever did before. So last summer, when things kind of opened up, I don't know if folks remember, in the summer of 2021, we were kind of in this nice sweet spot. You know, a number of individuals had been vaccinated from the adult perspective. We had started to see drops with regards to community transmission. It was a really nice place. And I have 2 children under the age of 12, and we would go to our community pool a lot. I became kind of known as this like vaccine lady at the pool. And a lot of people would come up to me and say, hey, do you mind talking to my friend? She has a question about the vaccine. And I was like, sure. This really got us thinking, how do we leverage that peer-to-peer approach? And I think, as one of the other panelists mentioned before, there has been a decline in trust in healthcare providers that we have been tracking essentially for 20 years. So even though healthcare providers are still trusted for many of the population, we do know that there's been a decline, and we've been able to observe that. And so one of the things that we've been trying to do is, what are other individuals that people can turn to, but we can make sure that they actually have very, very specific and evidence-based information to give. My biggest concern as someone that studies vaccine acceptance is I want to make sure that people are making a decision based on evidence. Even if they decline the vaccine at the end, I want to make sure that that information, again, their decision is informed by an evidence base and not necessarily social media, because we do see that many parents are making their decisions based on what they see on social media. And so what we decided to do, we went after, and we got a little bit of a small grant to essentially pull together a peer-to-peer communication course. As I mentioned, I'm a health communication individual. I worked in advertising for several years before I got my degree in public health. And so it was really great to be able to kind of tie all this together. And so what we did is we called upon a parent advisory group of 6 parents across the country, and we asked them, what types of things do you need to know? If you want to talk to other parents, if you want to talk to teachers, if you want to talk to family members, how do you navigate these kinds of conversations? And so they gave us some really, really, really great tips, helped us think about the delivery and the format, and we developed a course on Coursera, and I can drop it in the chat here in a minute. This only launched about 2 weeks ago, but we've gotten about 6,000 people that have already taken it so far, and many health departments are now requiring their healthcare workers to take it, and it's less than 2 hours. And the way that we have done this, and it's super fun, we spent time, we have fun videos in there, we have animated videos, we have whiteboard videos, but it essentially goes through a step-by-step process. So at the beginning, we talk about vaccine hesitancy, why people have concerns. The second module is what I would call the more like scientific module, where we talk about how does the immune system work? How do viruses work? And we go through that. And then the third module really focuses on communication techniques. And so it's actually really fun because you can practice some of them. We go over something called presumptive communication. We talk about motivational interviewing. We talk about tailoring for salience, for example. And this is essentially work that's been informed by our other RCTs that we've been working in this space. And the last module focuses on not only how to identify misinformation, but how to mitigate it. So we have put this course together. It is free. I will drop it in the chat. Anyone can take it. You can just sign up and you can take it. We've gotten some really great feedback on this. People seem to really like this. So our next step is we're actually going to translate this course into Spanish as well as French. We just received some additional money to do that. And our next step is thinking about how do we expand on this. This is very US centric because again, the funding was really for US parents, but we've gotten a lot of really interesting, I think, feedback and sort of interest from other countries that are saying, can you now make a version for us in Indonesia and in the Philippines? So we're navigating through that now and we're trying to decide how we want to do it. But it is asynchronous, it's self-paced. And you can take it. And one thing I can do, Carlos, if you give me a minute, if people are really interested, I can pull up one of the videos and share if that's okay with you. Okay.
Yeah, I think that'd be great.
Okay. Yes. So give me 1 minute. So go ahead. Maybe I'll turn it back over to you, Carlos, for just a second.
Yeah, as Sierra has been mentioning in the chat, please continue dropping in your questions. We did just see one question being answered by Dr. Bartlett. Thank you. I was asked by Rachel for, so I suggest folks check it out there. And just as a reminder, we are recording this session and we'll be sharing all of their resources after this. So if you want to share with other colleagues, we will have that. And yes, as Sierra pointed out, we did have a hand raised by Sherlita Ambler, so we'll go back to you once we get into the Q&A portion of this session.
But some of it isn't.
All right, let me try this again. Carlos, over to me, or yes?
Yes, go ahead.
Okay. All right. Hopefully, can you all see my screen okay?
Yes.
Yes. Okay, let's see. Let's make sure the volume works. Okay, here we go.
What is misinformation? Some of the information in this social media feed is true, but some of it isn't. How can we tell what's true from what's false? Social media allows false information about COVID-19 and vaccines to spread quickly from person to person, just like a virus. Hence the term going viral. Once you learn to spot false information, you can help stop the spread. There are a few different flavors of false information you might see online. Misinformation. This is when people share information that's actually false or misleading, but they don't realize they're sharing information that isn't true. This is like when your auntie or grandpa shares helpful articles on social media that are actually false. Disinformation. This is when people intentionally create false information and spread it to cause harm or to make money. This is like when someone makes up false news stories with phony images to drive traffic to their website so that they can sell ads or cause confusion. Both misinformation and disinformation are spread online by relying on a few tricks. Knowing these three strategies will help you spot false information and stop the spread. Emotion. Highly emotional stories spread more quickly on social media. Ask yourself if a post or story uses emotion words to generate fear, anger, outrage, or other emotions. Fake experts. Another strategy to trick us into spreading false information is presenting an unqualified person or organization as an expert. For example, someone may have a PhD or expertise in one field, like engineering or computer science, but that doesn't mean that they are a COVID-19 expert. Take a close look at whether an expert actually has training and credibility in the area they are talking about. Conspiracy theories. People can become more vulnerable to believing conspiracies during times of uncertainty. Conspiracy theories can be defined as believing that unexplained events are being carried out by a secret group or organization. Here are 4 steps to take to combat misinformation when you see it. Step 1, state the true fact. The vaccine was rushed, so it's not safe. Fact, the technology used to make COVID-19 vaccines is not new at all. It's been in development for decades. Step 2, warn about the misinformation myth. It's a common myth that the vaccine was rushed. Step 3, Explain how this myth is misleading people. The myth in this post is really misleading. It's because the technology used for these vaccines was actually very well researched over many years that they were able to produce vaccines in record time. Step 4, repeat the facts. The fact is that these vaccines are the result of many years of research and testing. Over 70,000 Americans were involved in the COVID-19 vaccine clinical trials in 2020. These trials showed that COVID-19 vaccines are very good at helping people stay safe and healthy. You can make a difference. Research has shown that debunking and correcting can help reduce the impact of misinformation.
So I will stop sharing there, but essentially, and I'm so glad my colleague Alex Michael's on, who also helped develop these videos, but it's really made up of a number of videos like that are very short and to the point, and it's really to walk away with hopefully being able to navigate these really difficult conversations. And the reason we came up with this idea, just so you all know, is that we were sort of discussing, we started working on this work essentially in September, and around, early November, people were like, oh, I have to go see my family member, and I'm not really quite sure how I'm going to talk to my uncle or my sister-in-law or whoever who doesn't believe in the vaccines. And so we thought, this is something that I think peers would really like to use. And I think the techniques that we do go over in this course are not necessarily just for vaccine conversations. You can use these techniques in any sort of difficult conversation that you may have. And so anyway, we had a lot of fun. We had a lot of fun pulling this together. It was in a very short time frame, but we seem to have gotten some really great feedback. So if you're interested, please do take the course and please do provide feedback, because we are trying to iteratively improve this course so that, we can have more peer-to-peer ambassadors be able to talk to one another. So I'll stop there.
Awesome. Thank you so much for sharing that. And again, we will be sharing all of these resources in our recap emails. Seems like folks seeing some chatter in the chat that folks were enjoying it. I think we can move on now to the Q&A portion. Again, drop your questions in the chat. We've been seeing some questions were in as the presentations were going on. We have one from Caitlin Roan. What do you all think of the mask mandate being lifted? And I know that's applying now state to state. I'm wondering, specifically, would be interesting to hear from communication side on the nuances of it's being lifted right now, but we still have to, continue testing. What do you all see moving forward with something like this occurring in some states? Anybody would like to go first? Yes, Dr. Maldonado.
Yeah, let me go ahead and start, because we need to kind of get the epidemiologic and public health context here. So I actually have a meeting on Friday with CDC and a few other key leaders around this, just so we all know. Many states are now starting to lift the mask mandates. California, for example, has a mask mandate that's going to expire next week. Obviously, we still have mask mandates here, for example, and the federal government has said in healthcare settings, in public transportation areas, and other key areas where you really do need to maintain a little more stringent protection. But I think the area of school age masking is critical and has been probably the most controversial, I think, on both sides. So some people saying that it's bad for children and they're all going to have horrible neurologic and developmental derangements based on zero data, and others who really think that it's not safe to go back until every single person is always masked with testing every day and everybody fully vaccinated. So there is, really, again, as I said earlier, this is about risk perception. And I think, as you all know, with the Kaiser Family Foundation, who's done a great job of, and by the way, there's some videos that we put in there that I did with the Kaiser Family Foundation, and also with some of my digital health colleagues here. We put together some short YouTube videos as well with very focused messaging. But the point is that when we get to a point where enough people are vaccinated and boosted, the risk so the original intent here with this virus was not to prevent every runny nose to prevent all infections. That was never the point, because you can't do that with most diseases. You're never going to be able to do that with a virus like this because it's a cold virus. You can't stop them. They're going to continue to circulate. But what we were trying to do from the very beginning when we worked with CDC and others is, how do we mitigate two major things? One is prevent severe disease, hospitalizations, and deaths to protect the most vulnerable people. And the second is, how do we prevent the disruption of our healthcare systems? Those are the two major outcomes that we looked at. So preventing serious outcomes, preventing a disruption of our healthcare systems overall. And when you look at what we've done with vaccines and mandates, even though we have the lowest vaccination rates of any industrialized country in the world, we still have enough vaccination levels and boosted levels to really reduce the risk of hospitalization and death. So if you look at studies of large populations, the risk of serious hospitalization and death if you've been vaccinated and boosted is it's astronomically low, unless you have an immunocompromising condition or really severe chronic conditions. So in theory, lifting the mask mandate is, in highly vaccinated communities or highly infected communities, is probably not going to be a problem. But allowing people to continue to wear their masks if they feel comfortable doing so, or if you're in large crowded areas, or if you're in areas where you don't know the status of other people around you and you have family members or colleagues who do have risk factors, allowing that to happen might be good. So we may be in the point where we're starting to transition into this massive pandemic response to more of an easing into an endemic response where masking and may not be an issue. Now, vaccine mandates are a whole different issue, which I don't know if we want to go into that discussion right now. We could take that separately. But I do think the mask issue is starting to move into that area where people feel comfortable, and that's the key. If people don't feel comfortable, they can still wear masks. But if we feel that masking is not mandatory, then I think it's reasonable, as long as there's good messaging, and my two colleagues here can talk more about the messaging aspects. Keeping in mind that we don't know what might happen 3 months, 6 months, or a year from now. We're hoping, we have data that suggests that with each variant, we're seeing a lower and lower risk of death and hospitalization. So there may be some underlying immune boosting going on, or other issues, or evolution of the virus, but that's a separate thing. The point is that if things stay the way they are, that is, we lose the Omicron variant and things are settled for a while, there may not be a reason to have mask mandates at this point. But we also need to keep people in mind that there's a lot of flexibility around that. People shouldn't be, I don't think people should be chastised for wanting to keep wearing masks. And we should also be able to give people the heads up that if things change, we may need to go back to certain mitigation efforts.
Certainly, I think it'll be important to communicate those nuances moving forward. Dr. Bartlett, anything you would add to that?
I think coming back a little bit to what Dr. Maldonado mentioned about the school setting, I think that masks remain an integral part of keeping students in the classroom, especially while vaccination rates are low. Children are not nearly as bothered by mask use as their grown-ups sometimes are. I think I also worry about bullying, or children who are feeling pressure if there's a mask optional classroom. I would love to think my kids are strong enough to choose to wear a mask, but I wouldn't have been. So I think that requiring masks in schools is, especially during the winter months, are going to be a really important continued mitigation step.
Thank you. We have another question here from an attendee for Dr. Lemay. Dr. Lemay mentioned using a parent advisory board to inform your vaccine ambassador training. Could you discuss how you specifically tailor this training for parents, if possible, or how you've seen parents, caregivers use this training to become vaccine ambassadors?
Yeah, Yeah, it's a really great question. And what we decided very early on is we didn't want to just develop a course because we thought it was a good idea. And many of us that are parents of small children were having these conversations naturally and organically with other parents. And so we really use this group to help us think about, like, we are vaccine scientists. I was very much like, you guys need to learn everything about the immune system. And the parent group was like, no, Rupali, we don't. So it was very useful for us, right? Because I think we can get very much in the weeds and we can be very dense about things. And so that's how it really helped us. They met with us actually 3 times over the 3 months that we developed this. Once a month, we showed them different materials. They gave us feedback. We went back and revised them, and they were really integral for us. 3 of them were actually teachers. And then 3 of them, again, were parents, but we were really lucky to have this group just to be able to rely on and sort of, I think, truth check a lot of this, right? Because we're sort of steeped in this space. And so I feel like what we think is important is not maybe what parents want. So that's why we went that way.
Thank you. Have another question here from Dr. Wen Unsicker. Apologies if I mispronounce that. How do we get people who think that the accurate information is the disinformation to engage with courses like this amazing vaccine ambassador training?
It's a really good question. One of the things that we're really seeing is that one thing I will say very clearly is that individuals that are hesitant, they usually can still be persuaded. There's a small proportion of the population that's truly fundamentally, philosophically opposed to vaccines. Most people just need a little bit more information. Now, do I think individuals that are really sort of anti-vax are going to want to take this course? Probably not, right? But that's not really the intent. My take on this is that, can we use this course as a way to just start dialogue? And again, I didn't touch upon this because we didn't have time, but we've become more and more polarized generally as a country. That includes vaccine attitudes, unfortunately, and that has now been intersected and interacted, I would say, with individuals with regards to mask mandates, with lockdowns. So my point is that this is really a way for us to start to have these conversations with people that we don't see eye to eye with, right? And if I can talk to someone, I've probably spoken to about 3,000 hesitant people over the last 2 years. In the end, the best thing I can do is, yes, I would love all of them to get vaccinated. I think that for the majority of people, the benefits outweigh the risks, right? However, I am happy if I can just have a conversation, if they feel as though I listened to them, if I was not dismissive, and if I was empathetic, because to me, that's just the start of the conversation. And the pediatrics folks that we work with, especially, we've talked a lot about this, is that it's really hard to persuade on the first visit, right? It's sort of the long game, if you will, which is hard, right? And it's hard for a lot of us to not get emotional when someone is in your face and sort of screaming at you. But the goal here is to start to build that relationship so that you are a trusted source. So if something comes up down the line, maybe they don't vaccinate now, but maybe 6 months from now, they come back to you and they say, I've thought about this. What do you think? And they end up actually getting the vaccine. Again, it's hard because it's not a short-term, quick win, but it's more of a long-term game.
Thank you. Wondering, we have just 1 minute left. Anything from Dr. Maldonado or Dr. Bartlett that you'd want to add before we close up the webinar? No? Okay. We still have some questions here. Maybe we have time for one more. How do you get public health to be the messenger and not politicians? Political leaders do have a place during a disaster, but when it comes to medicine, they usually are not the trusted source. How can we get them to understand that? Our speakers today are trusted sources. Wondering any of you that would have experience in that and would like to share some reflections.
Yeah, so I've been working with 3 of the federal agencies, with the NIH, CDC, and FDA for many years now, and more recently with the COVID responses as well. I think, I don't know if any of you saw there's been a couple of pieces in the New York Times and other places essentially saying the same thing. I think it's just the nature of politics. It's a very high level. It's on everybody's mind. So of course the politicians are going to weigh in. It's hard for them not to integrate their responses with the public health agencies who actually know best, or the regulatory agencies who know best, et cetera. It would be nice to see a more integrated response. And we've certainly been messaging very hard to all of our agencies about trying to make sure that happens. So hopefully, I haven't seen great examples from very many places around the world. I would have to say that New Zealand has done a really remarkable job about messaging and following through. But again, they're a small country. They're an island, and I think some places have done really great jobs, others have not. And I think part of the other issue is that the message changes on almost, I would say, at least a daily basis, if not sooner. So how do you message consistently across all of these groups? And I think that is a key question that most of us who work with these agencies have been trying to make clear and supporting. See, one of the things we can do is support our public health agencies and our federal agencies and reinforce the messages that they're putting across, and trying to bridge the political messages with the public health type messages. So yeah, but I think everyone gets that this communication scheme is not exactly optimal.
Absolutely.
It builds on decades of underfunding and under supporting and under recognition the importance of our public health professionals. And so we are asking a very small group of people to do a lot, which is why it is important that the rest of us help out.
Absolutely. All right. With that,
I was just going to say, Carlos, I would add one thing. I know we're over time.
Yeah,
So earlier on in the pandemic, so we've been working with the White House task team. I work primarily internationally. And so we've been working closely with COVAX with the rollout there. But what's been great and what we've tried to do in Baltimore is when we worked with the governor's office and the mayor's office, we helped write the talking points for the weekly sort of press briefings that they were having. And I think that would go a long way, is just having a coordinated sort of need to know sort of communication response. And what we did at the beginning is we asked for 3 things for every press briefing. Here's what I know, here's what I don't know, here's what I'm asking you to do. So I think even coming up with a very simple template that I think all leaders could use would also, I think, just help, reduce some of the confusion that I think many people are seeing.
Absolutely.
Sorry, I know we're over.
No, I want to thank all 3 of our panelists so much for your valuable time and participation in this. We deeply appreciate it. And thank you for all the attendees for joining us again. We'll do another one of these in 2 weeks, and we'll send you more information then. And we'll send a recap with all the great information and resources shared today. Thank you all again.
Thank you, everyone.